Hi, this is Brian Wormers recording a lecture on musculoskeletal trauma for medical surgical nursing at the University of Sioux Falls. So some of our learning objectives with this, we're going to be talking about doing a focus assessment on musculoskeletal and neurovascular trauma. So we're going to identify nursing priorities for patients with musculoskeletal trauma. We'll talk about interventions, collaborative management for those patients with musculoskeletal trauma, and we're going to plan for postoperative care after an amputation. So sports-related injury, so realize that there is could be quite a bit of this. Trauma can cause cartilage, ligament, and tendon damage. Knee is most commonly injured with this one. And so with these type of situations, we're going to see, of course, we're going to get a good H&P on this, but then we might see abnormalities on radiology and ultrasound. Some of these can be sprains and strains, and so a sprain is with your ligament, and strain is with your tendon, so T for tendon with your T for strain. Management's going to be very similar of this one, so rest, ice, compress, and elevate. Immobilization if we have to, and then limit activity, inflammatory, pain meds for both, so NSAIDs are probably a mainstay of this. And then if significant enough, we might have to do surgery, but that's not common. Amputation, so we might have to remove part of a body. So this could be either elective or traumatic. So elective is more commonly related to like diabetes mellitus, in which you're getting poor perfusion there, and peripheral vascular disease, versus traumatic, in which it's being cut off. And key things for traumatic stuff that I've seen commonly would be related to lawnmowers and snowblowers. Level amputation, so like I said, this is more common of lower extremities, and especially for the elective stuff. And so it just kind of depends. You don't want to cut more off than what you have to, but yet if we're talking about diabetes mellitus and side effects of that like gangrene, you do want to make sure that you just do the amputation once and you get all the negative aspects off, and that way it doesn't spread. Health promotion wise, so we're going to maintain a healthy weight, try to avoid smoking, prevent chronic diseases like diabetes, and poor blood circulation. So on our assessment, some of the things that we'll see, of course, would be pain, and this pain could be related to the site. Otherwise, it could be neurovascular. It could be phantom limb pain, which is going to be hard to treat, but we can give things like Neurontin and different things like that, gabapentin, to try and help with that. At that site, we're going to make sure that the skin is healing well, no edema, no ulcerations or necrosis. So psychosocial, this is a huge part of it. We cut a part of their body off, and so realize that this could be very traumatic for them. Diagnostic-wise, we do want to do Dopplers to make sure we get good blood flow to all the tissue up into that point. So planning and implementation for this. So it's similar to a fracture diagnosis to some extent, but realize that this is body image distortion and lifestyle adaptation are huge with this. So interventions, like I said, phantom limb pain. They've got pain in that missing body part related to the nerve endings and nerve signals that they're getting. Are at higher risk from neuromas from this one, so it's of those nerve damaged cells and stuff like that, you can get a tumor forming on that. They can have hemorrhage at the site, especially if we're talking about a non-scheduled traumatic type of amputation. Then of course, hemorrhage is a major cause of this one. And then we do want pain modalities as appropriate. If we're worried about infection, so like I said, if this is an acute type of situation or a trauma, we want to make sure that antibiotics are given, because lawnmowers and snowblowers are not necessarily clean mechanisms. We do want to promote mobility as possible, prosthesis afterwards, consult with physiatrists, physical therapists, occupational therapists, those type of situations. And then, really good range of motion. We do want to promote body image and lifestyle adaptation as best as possible. So care for limb and prosthesis. So you're going to wrap that site 3 times a day. We're using figure 8s. There are different ways to do this. This is still a common way to do it. I've seen different stockinettes or different things like that. But the big thing is wash that site for skin breakdown, irritation. Make sure that we don't get ulcerations, and make sure that that site heals up really well. Knee injuries. So with this, we can have meniscus injuries, pain, swelling, tenderness, popping or clicking. With this, we'll do a McMurray's test, which is stabilizing the knee, bending it, and then just rotating the foot a little bit. And if you feel if it elicits pain or popping, then that's a positive sign, and that could be related to your meniscal tears. Post-surgery is common for this one, but realize that we're going to start exercises immediately and work on therapy as we're doing this, immobilizing with crutches afterwards, and letting that heal. Can get ligament damage with this, so ACL, MCL, those are real things that we're seeing quite a bit. They might feel a snap during an acute event of this. Afterwards, it's going to be swollen, stiff, and painful. Orthopedic surgeon will decide if they need surgery or non-surgery on this one. If they need surgery, of course, we're going to be doing a lot of therapy, including a CPM machine, getting them to move that leg as much as possible. Carpal tunnel, so this is a median nerve in the wrist. It's compressed. So what you're going to see is pain and numbness, tingling. And so this is a repetitive stress injury. The things that we'll do with this is, are they having pain that often is worse at night, numbness, tingling, and we'll do Fallon's test. So this is when you put the wrists together with the hands in a downward. There is a reverse Fallon's where it looks like you're praying with the fingertips in an upright thing, but true Fallon's is your back of your hand to back of the hand and wrists are touching, and you try to hold that for 60 seconds. If there's pain, numbness, or tingling, that's a positive sign, and that's not what you want. Oftentimes this is related to workstations or repetitive motions, and so we really try and have good biomechanics and have things ergonomically appropriate. Some of these patients will need surgery, but otherwise non-surgical things would be immobilization, steroids, NSAIDs, could be thermal modalities such as heat or ice as well. Joint location, so these are when the joint, two ends of the bones are moved away from each other. Can be any synovial joint, shoulders, hips, knees, fingers, elbows, and the injury is often the result of trauma. And this could be, you can think about football injuries or sports injuries. You can think about, somebody grabbing and yanking on an arm. Any of those kind of things can cause a dislocation. So assessment, pain, immobility of that joint, alterations of the joint, so it's bending in ways it normally should not, deviation of length of the extremity, and then impact of the mobility of that extremity. So ideally what we want to do is do a closed reduction of that joint. Might need some sedation. That's kind of a nice way to do that. Both for the patient standpoint, and it helps the clinician when the body is more relaxed. And then after you get that reduced, then you immobilize it. So reduction just means that you're pulling it, manipulating it to put it back where it belongs. Rotator cuff injuries, very common in the shoulders, because that's where your rotator cuff is. But they can't abduct at the shoulder, so usually has more pain at night, difficulty with overhead activities, and then you can do an arm drop test where you hold the arm out, you abduct it, and then if you let it go, does it drop down? So treatment-wise, NSAIDs, steroids, physical therapy, and then of course if these are not working, surgery to correct. So that concludes this lecture. If you have any questions, please contact me.